Hello, Dr. Joe here of the 2020forum.com. So when I did my last video on the signs and symptoms of colorectal cancer, some of you requested that I do a video on the prevention strategies. So this video is in response to that request. In this video, I'm going to give you 7 strategies that you can use to reduce your risk of developing colorectal cancer. Now, before we continue, let me just recap on the at-risk individuals, because their risk is higher than the rest of the population. Everyone is at risk, but these guys just have a higher risk than the rest of the population. So who are they? These are the at-risk groups. Someone who's got a personal or family history of colorectal cancer or colorectal polyps. Someone who's got familial adenomatous polyposis. This is a medical condition. Someone who's got hereditary non-polyposis colorectal cancer, what we also call Lynch syndrome. Someone who's got inflammatory bowel disease. In this instance, I'm referring to Crohn's disease or ulcerative colitis. Race is a factor. Black people and Ashkenazi Jews, they also have a higher risk. So if you belong to any of these categories or a combination of these, then you really need to pay special attention to this video, because I'm going to be talking about strategies that you can use to prevent colon cancer or reduce your risk at the very least. Okay, so let's talk about the prevention strategies. So prevention strategy number 1 is screening. Okay, pretty obvious. Screening is by far the most potent tool you have to reduce your risk of colorectal cancer. Why is that? It's because most colon cancer cases actually begin as small growths in the bowel, what we call polyps. For the most part, a lot of the polyps, they are benign, they're not nasty. But some of them will progress to become cancer. But the progression is not from benign to cancer straight away. There's a scale of progression. So they move from benign and then they become precancerous, and then before they become cancerous. And this happens over a good number of years. So what you want to do, and why screening is important, is that you want to catch them early. You want to catch these polyps early. You resect them, preferably when they're still benign or at the pre-cancerous stage. Because when you do that, you completely eliminate the risk of that growth, that polyp, becoming cancerous. So that's why screening is important. So what are the screening tools we have available to us? They come in 2 forms, by the way. They're either non-invasive or invasive. Okay, so what are the non-invasive ones? Let's talk about those ones briefly. The non-invasive tests, what we got 2, the stool test and the virtual colonoscopy, also referred to as CT colonography. The stool test is fairly obvious. You send your stool to the lab, they have a look at it. Is that a positive or negative? The virtual colonoscopy, they just use a CT scan. They take 3D dimensions of your colon. If they see a lesion, then you move on to the next step. Now, these non-invasive tests, they're actually screening for screening, in the sense that they're not diagnostic. So if you're positive, you then progress to the invasive test. So the non-invasive tests usually lead to the invasive tests. So what are the invasive tests? Here we are. The invasive tests, we got 2, the sigmoidoscopy, and the second one is colonoscopy. Now, the sigmoidoscopy is usually a flexible sigmoidoscopy. It looks at the lower aspects of the bowel. So we got the image here. So you start off, they got to look at the rectum. So the endoscopist will start off with the rectum, goes on to the sigmoid colon, and then also looks at the descending colon. Okay, so usually flexible sigmoidoscopy ends here. Okay, now colonoscopy, on the other hand, starts off from the rectum, goes on to the sigmoid colon, and then the descending colon, and then the transverse colon. Okay, and then also looks at the ascending colon. Okay, so essentially the colonoscopy is superior, in my opinion, because you're looking at the entire length of the colon, of the large bowel. Okay, and when you do that, you're more likely to see any polyp around here, and you can resect them. So for me, if I have to choose between sigmoidoscopy and colonoscopy, I will go for colonoscopy all the time, because you're visualizing the entire colon, and if you see any polyps there, of course you resect them. So that's prevention tool number 1. Prevention tool number 2 is aspirin use in the 50 to 59 age group. So this is a recommendation actually by the US Preventive Services Task Force, and I'll read it out to you here. Here's the recommendation. It says, the task force recommends initiating low-dose aspirin use for the primary prevention of cardiovascular disease and colorectal cancer in adults aged 50 to 59 years who have 10% or greater 10-year cardiovascular risk and are not at increased risk for bleeding, because using aspirin thins out your blood, so it puts you at risk of bleeding. Also have a life expectancy of at least 10 years and are willing to take low-dose aspirin daily for at least 10 years. And that's a grade B recommendation, which is fairly high, okay? So aspirin use, that's prevention tool number 2 for colorectal cancer prevention. Prevention strategy number 3 for colorectal cancer prevention is eating a high-fiber diet. Having a high-fiber diet is generally a good thing because, at least it prevents constipation, and it is also good for your overall health. It helps reduce your cholesterol levels. So you should be aiming to consume about 30 grams of fiber a day. Whilst you're doing that, please drink plenty of water to go with it. Very, very important. So that's prevention strategy number 3. Prevention strategy number 4 is avoiding processed meat. Okay, we're referring to, salami, bacon, sausages, hot dogs. The population-based studies have been linked, or rather have linked consumption of processed meat to bowel cancer, colon cancer, especially for those who are consuming more than 70 grams of processed meat a day. So if you cannot avoid consuming processed meat, you should at least reduce your consumption to less than 50 grams per day, okay? Avoidance is probably best, and the reason for that is that the processed meats, they have nitrates in them, and these nitrates get converted to nitrosamines, and those nitrosamines are potentially carcinogenic. So prevention strategy for colon cancer number 5 is avoiding tobacco. That's pretty obvious. I don't need to say much about that, okay? So let's move on to prevention tool number 6 to prevent colorectal cancer is reducing your alcohol consumption. They're very important. If you cannot avoid alcohol altogether, you should at least just have a moderate consumption or less than moderate. That will help you to reduce your risk of developing colorectal cancer. Prevention strategy number 7 is regular physical activity. This is very important. I don't need to say much about that. Exercise is good for your overall health, and you should be aiming to do about 150 minutes of regular exercise per week. It will help to maintain your weight because obesity is also a risk factor. So those are your prevention strategies. Those are the 7 prevention strategies that will help you to reduce your risk of developing colorectal cancer. So as usual, if you got some value from this video, please give the video a thumbs up. Please like the video, and also please share this video with your friends, family, and colleagues. Now, what do you think of recommendation number 2, the prevention strategy number 2, the use of aspirin? Are you somebody who is already using aspirin? Do you belong to that age group? Are you using aspirin for any other reason? If you are, what's your experience been like? Do let me know in the comment section. And of course, or if you've had a colonoscopy, also do let me know about your experience as well. Also, are you someone who consumes a lot of processed meat? If you are one of those, also please do let me know and what you're going to be doing about it. And if you haven't joined us yet at the 2020 Forum platform, please go ahead and join us. Over there, we talk about high blood pressure and other wellness issues. Now, there should be 2 videos on your screen now. Go ahead to click to watch any of them. They are videos designed to help you take control of your health. I think that's about it. Until next time, well, this is Dr. Joe signing out.